Hi everyone, we are from Group 14. We'll be explaining about the lung cancer diagnostic. I'm Sufeta Farzana. We'll be explaining about the introduction. For the lung cancer, it is a normal cell in the lung that had been grown out of control and caused the cancer. The spread of the cancer cell to the normal cell will be called as metastasis. From the history, during 1700, the Morgagni GB, which is an anatomist, had found 17 cases of cancer during his finding in the disease organ. In 1761, Dr. John Hill of London had carried out the study of relationship between tobacco and cancer itself. During 1869 until 1877, the Miners disease had caused the death of the 150 people which worked in the labor forces. During 1879, an autopsy by the Harding and Hurst had proven the theory of Dr. John Hill of London when they had found the disease in the miners that had died, which is the pulmonary sarcoma and the Berg syndrome itself. So next, for the type of cells, there are two types of cell, which is SCLC, small cell lung cancer, and non-SCLC. For the SCLC, it is usually in the smoker, had low survival rate, and spread faster. For the squamous cell carcinoma, it is immobilized cancer cell that can basically be happen for the people and has the higher rate of response treatment. For the adenocarcinoma, it is basically the most common one and can form in the glandular structure form. For the large cell carcinoma, this is the irregular shape, has no prediction where it might originate from, and has higher rate of growth, can be considered as the dangerous one. For the demographic, based on the American Cancer Society, there are age that we should consider. People with mid-age number, which is among 35 until 45, are high likely to have this disease. For the gender, men has 12% higher probability than women to get this lung cancer. And for occupation, those who work with exposure to the substance that is dangerous like asbestos has likely to get this cancer.
Hi, I'm Adriana. So I'll be continuing the presentation with a discussion on the current technologies involved in lung cancer diagnosis and also treatment. Right, so lung cancer is associated with such a high mortality because oftentimes it is diagnosed late. One of the best ways to improve the lung cancer outcomes is to diagnose it early through screening using low-dose CT scan. It is a quick 15-minute process that can detect lung cancer before a person experiences symptoms. Once patient gets into the scanner, and then it spins around the side of the gantry, which contains the X-ray tube. It will scan the whole body like a bread slicer, and then images are then being taken and being sent through the electronic system and read through the workstations. Right, so when a patient comes in with a lung nodule, they can be seen by a number of different people, and if it is metabolically active, the doctors will proceed straight to biopsy to avoid delay in diagnosis. There's a couple of options in terms of how patients can be approached to the biopsy. One way is to do a bronchoscopy, which involves going down your airways with a small flexible scope and trying to biopsy a nodule from within. The other option is for a radiologist to do a needle biopsy from outside of the lung, as in the second figure. Right. These methods, though, may not be able to reach nodules if they are further out in the branches of the lung. Advances have been made in the recent years, which combine the bronchoscopic system with ultrasound technology, and the example of this includes the endobronchial ultrasound, EBUS, and esophageal ultrasound, EUS. In regards to the early detection of lung cancer, plasma microRNAs are also extensively studied from the exhaled breath condensate, where differentially expressed miRNAs are identified in lung cancer patients. These are the current treatment options for lung cancer. We have surgery, chemotherapy, and also radiotherapy. So when will surgery becomes an option? So it would be viable for localized cancer, usually stage 1 or stage 2. So the descriptions below displays different surgery approaches, which is usually decided by the doctor upon the size, location of the tumor, and also the patient's lung capacity. Right. So as for later stage, surgery would not be the best option as mentioned, or radiation. So chemotherapy is used mainly in stage 4, but also opted in stage 3A and 3B as an adjunctive therapy after surgery to prevent the recurrence of cancer. This method of treatment uses drugs to kill cancer cells, which is given intravenously or taken orally. Radiation therapy, on the other hand, uses X-rays and protons to treat cancer, in which for later stage of lung cancer, stage 3, combined drug and radiotherapy is the tried and tested cure. So last but not least from me is on advances in lung cancer management. These can be looked upon into the application of nanoparticles in medicine. The application of liposome as lipid-based nanocarriers is demonstrated through a study conducted by Zhu and his co-workers using docetaxel folic acid-loaded liposomes as anti-cancer drugs in the form of nanoparticulate dry powders. So when compared to intravenous injection, the study found that tracheal administration led to a 45-fold higher concentration of docetaxel in the lung of sprout daily rats at 30 minutes. So overall, the liposome-based inhaled dry powders have been proposed as a potential clinical therapy because they exhibit greater anti-cancer activity at tumor sites while overall posing less risk to healthy organs.
Hi, I'm Fahmi and I will explain the analysis of current technology. Only by current technology, which are screening, diagnosis, and treatment, can the mortality rate of those with lung cancer decreased. Low-dose computer tomography LDCT is currently used for screening, bronchoscopy for diagnosis of lung cancer, and three most current treatment technology that are used to treat lung cancer, which are surgery, radiotherapy, and also nanomedicine. However, these technology have also their own limitation. For screening, LDCT is used for patients with risky and high stage. False positive results happen when a patient is misinformed that they are affected with cancer, while false negative is otherwise. This is due to several factors such as location, size, and shapes of the nodules. Other complications are overdiagnosis, radiation exposure, death, and complications. Currently, CAT system is the best system to upgrade the accuracy of LDCT in detecting the tumors. For diagnosis, bronchoscopy is the most current diagnosis technique to check the abnormality of the lung. Common limitations are the mechanical complications related to airway manipulation, trauma, bleeding, and infection. For treatments, first, lobectomy is a curative but radical treatment which involves removal of certain lobes or part of defected lungs. Compared to a pneumonectomy, which entails removing the entire lung, this treatment is less intrusive and preserves greater lung function. Surgery complications that could happen are air outflow, plugging of mucus pneumonia, leakage of lymphatic fluid in between the chest and the lung space, unusual electric signal to atrium, twisting middle right lobe, and the injury. For radiotherapy, it is considered a common palliative therapeutic option compared to surgery, which is a curative method. By this, its limitation, it could destroy the normal cells such as hair follicles, normal cells near the targeted areas, also cause the treatment injury. It is also complex, time-consuming procedures, high cost, and patient immobilization. For nanomedicine, low delivery efficiency and also poor clinical outcomes are the most significant limitations, which due to two main factors, which are complexity and different types of tumors in the bone.
Hi, my name is Kobe and allow me to walk you through the impacts of the photodynamic therapy PDT for lung cancer towards society, environment, and sustainability. Without further ado, let's talk about the impact towards the society, which is it is enhance the quality of life. PDT is a minimally invasive procedure that may result in a fewer adverse effects and complications than more invasive treatments. This can result in higher quality of life for lung cancer patients, which then allowing them to better manage their symptoms and continue with their daily activities with minimal interruptions. Next, the impacts towards environment as it is reduced the toxicity. To eliminate cancer cells, PDT uses a photosensitizing agent that is activated by light. PDT typically has a localized effects targeting the tumor while minimizing injuries to healthy tissues, in contrast to some conventional treatments such as chemotherapy. Consequently, it may reduce the discharge of toxic substance into the environment. Moving on to the impact of the sustainability, it lowers our resource consumption. PDT requires typically fewer resources than major surgical interventions or extensive radiation therapy, so it may involve shortened hospital stays, fewer diagnostic procedures, and less demand for medical supplies. And this reduced consumptions of resources can be contributed to the sustainability of the healthcare systems. Although PDT may have positive societal, environmental, and sustainable outcomes, more studies and evaluation is required to properly understand and quantify these implications. Moreover, an extensive assessment ought to consider about things like economic viability and social equality in healthcare delivery because of the complex and diverse character of sustainability. That should conclude everything from Group 4. Thank you.
Hi, my name is Zarfan. So for the next topic is about new ideas for the current technology in the treatment of lung cancer. So the ideas is photodynamic therapy. What is photodynamic therapy? It's a treatment that involves light sensitive medicine and a light source to destroy the cell or the abnormal cells. So by using light sensitive medicines, which is known as photosensitizer, will be injected or will be cream form apply on top of the infected skin or suspected tumor, and by using a light source such as a red light, it will stimulate the cell tumor, which is sensitive to the light due to the photosensitizer, to generate oxygen radical and kill the cell tumor. However, the limitation for this current technology is due to the usage of light source to stimulate the cell cancer to kill the cell cancer. It limited to the capability of the light source, which is inability to penetrate deep enough to this to stimulate the cell cancer. Other than that, type of photosynthesizer that had to be directed to the cell cancer that located deep inside our body, such as a lung cancer. So that's all from me.